Hello, namaste everyone. Welcome to our YouTube channel Dr. D18. Today we are going to discuss some more question on the circulatory system. So the first question is, which of the following is incorrect? Here the heart is endodermal in origin. So this first statement is wrong. Heart is not endodermal in origin. Heart is the mesodermal in origin. So this is the wrong statement. Now second statement is, human heart is situated in between the two lungs, slightly tilted to the left. So this is the correct statement. And heart is a double walled membranous bag. This is also the correct statement. And the human heart has two atria and the two ventricles. This is also the correct statement. So the answer will be the first option. Heart is a endodermal in origin, which is the incorrect statement. So this is the correct answer. Now let's move in the next question. Next question is, lymphatic system is an elaborated network of vessels which collect the. So lymphatic system is an elaborated network of vessels which collect the. Option number A, interstitial fluid. Option number B is intrastitial fluid. Option C, plasma fluid. And option D is protein fluid. So the correct option is interstitial fluid. So if you want to know the lymphatic system, see here the artery comes and this side the vein comes. So the blood from the artery goes to there is a small number of capillaries. Through the capillaries, blood passes to the venules, and during this process some fluid comes out of the capillaries and do not go the veins. So this is the interstitial fluid. This is called the interstitial fluid. Okay. Similarly, if the WBC comes out of here, if the WBC comes out of here through the capillaries WBC, then this process is known as the diapedesis. So this is another important point. So here the correct option is interstitial fluid. Now next question is, in human heart, identify the correct statement. So volume of both the atria is greater than the volume of the both ventricles. So this is the incorrect option, because the volume of both the ventricle is greater than the volume of atria. So here the volume of both the ventricle is greater than the volume of both the atria. This is the correct statement. Now next option is, interventricular septum separates the right and the left ventricle, right and the left atria. So interventricular septum do not separate the atria, it separates the ventricle, right and the left ventricle. So this is also the incorrect statement. Now next statement is, atrioventricular septum do not separate the atrium and the ventricle. This is also the wrong statement, because the atrioventricular septum separates the atrium and the ventricle. So this is also the wrong statement. So the correct statement here is only here, option number 2, volume of both the ventricle is greater than the volume of both the atria. Choose the correct option according to all except 2 is wrong statement. So here the correct option is option number B. Okay. So now next question is, SA node generates an action potential which stimulates both the A and to undergo a simultaneous contraction called the P. Okay. This increases the flow of the blood into the ventricles by about how much percentage? So see here, SA node generates the action potential which stimulates both the what? So here option A is atrium. It stimulates both the atria. It stimulates both the atria, and to undergo a simultaneous contraction contraction called the B. It is called as the atrial systole. So B is called the atrial systole, and this increases the flow of the blood into the ventricles by about 30%. So if you see in the cardiac cycle, about 30% of the blood goes to the ventricles in the atrial systole phase. So now let's see the option. See, option A is atria, and the B is atrial systole, and percentage of blood increases 30%. So yeah, the correct option is A. The correct option is A. Okay. Now let's move in the next question. The normal percentage of glucose in the blood of man is 0.1%. It is found in. So the question is here tricky. Normal percentage of glucose in the blood is 0.1%. So here the question is asking in which component of the blood the glucose level is 0.1%, means 1 gram per deciliter. In the plasma, option number A, option B is RBCs, option C is WBC, and option D is serum. So if you see in the serum glucose, the percentage of glucose in the blood is 70 to 100 mg per deciliter. So this option is not correct. So 0.1% glucose is found in the plasma. Okay. Now let's moving toward the next question. Systemic heart refers to the, see here, systemic heart refers to the enteric heart in the lower vertebrates. Option B is the two ventricles together in humans. No, this is not a systemic. And the next option is the heart that contracts under the stimulation from the nervous system. No, this is also wrong, because the heart is an autonomous organ. Left auricle and the left ventricle in the higher vertebrates. This is also wrong. So the correct option is here, the enteric heart in the lower vertebrates. Now let's move toward the next question. Which of the following can be considered as the blood bank of the human body? So here the option given is spleen, heart, liver, lungs. So the correct option here is spleen. Spleen is considered as the blood bank in the human body. Now next question is coagulation of the blood in the blood vessels in the living body is prevented by, okay, it's prevented by prothrombin. No, this is not correct option. Which is prevented by the coagulation of blood in the blood vessel in the living body is prevented by the heparin. Heparin is the correct answer here. Prothrombin and calcium together, these all are the clotting factors. Okay. Now in the next question, characteristics of the open circulatory system. So here the blood flow in the open tissue space, the sinuses. This is the correct statement. Blood is in direct contact with the tissue cell. This is also the correct statement. Blood flow is slow. Okay. Yeah, also the blood flow is also slow in the open circulatory system. So here you have to choose the correct option with the characteristics. Option 4 is blood pressure is high. This is the wrong. So in the option given all the except 2, all the except 1, all the except 3, and all the except the 4. So the correct option is all the except the 4, because the option number 4 is the blood pressure is high, but there is blood pressure is low. Okay. In the next question, in a healthy adult man, the normal diastolic pressure, so the low pressure, diastolic pressure means the less pressure, no, 80, 100, we write the 120 by 80. 120 is systolic pressure and 80 is the diastolic pressure. So in the healthy normal diastolic pressure is 80 mmHg. Option number C is the correct. Now which of the following carries the glucose from the digestive tract to the liver? So here, which carries the glucose from the digestive tract to the liver? Hepatic artery? No, this does not carry the glucose from the digestive tract to the liver. Hepatic portal vein, pulmonary vein, none of these. So here the hepatic portal vein, which carries the glucose from the digestive tract to the liver. Now next question is, When the balloon of nitrotic balloon pump inflates, more blood is carried by. See here, in the question it is asked that when the aortic pump, when there is more blood in the aorta, which more blood is carried to which artery? So if you see here in the heart, this is the heart, from there the aorta comes out, and in the base of the aorta there is the coronary artery, two coronary artery comes out. So when the blood flow is more in the aorta, so the more blood is carried to the coronary artery. So here the correct option is coronary artery. Okay, now next question is, clotting disorders occurs mainly due to the reduction in the number of. So in this granulocyte is a type of WBC. This is the wrong option. RBC, this is also wrong option. WBC, this is also wrong option. And platelets, this helps in the clotting. Now next question is, which of the following is the matching pair of a certain body feature and its value count in the normal human adult? So urea level in the normal human is 10 to 50 mg per deciliter, 10 to 50 mg per deciliter. So this is the wrong option. Okay, now next is blood sugar is 70 to 100 mg per deciliter in the fasting. Okay, this is the right. And next is total blood volume, 5 to 6. Here it is not mentioned, the unit is not mentioned here, liter or what. So this is also wrong option. In the fourth option, ESR in the Winthrop, ESR value is 9.9 to 15 mm in the males and the 20 to 34 in the females. This is right, but in the female it is below 20, less than the 20 mg per deciliter. So here the correct option is option number B. Okay, the next question is, which of the following are the erythropoietic organs? Option A is liver. Okay, this is also the erythropoietic organs. Option 2 is a lymph node. Option 3 is a spleen. This is also erythropoietic. And then the red bone marrow. This is also the erythropoietic. So the correct option is 1, 3 and 5. So here sometimes the lymph node is also act as a erythropoietic. So here the correct wrong option is only 4. So all except 1, all except 2, all except 1, all except 4. This is the correct answer. So thank you everyone.